I'm Suneel Chilukuri. I'm a board-certified dermatologist from Houston, Texas. I trained originally in plastic surgery and then went into dermatology, and then I did a Mohs fellowship as well as a laser fellowship. So we have a wide range of things that we can do with the skin.
I know. Talking about that, about your highly specialized, I think that in the market there is a lot of system that says that they're good for everything. And these 2 years that we have been dealing with Scarlet, talking with the KOL doctors here in Mexico, everybody told us that's not true. So what do you prefer? Do you prefer to work with something that is highly specialized like Scarlet for face, neck, hands, elbows, knees? What do you prefer? What is the thing that you look in a system?
So anytime that we get to evaluate a system, we look for what's that device going to do, what's that class of device. In this case, we're talking about radiofrequency microneedling. In that space of radiofrequency microneedling, we've been working with technology since 2008. The original device that we use is called Profound. And when that was there, we put the needles inside the skin and you just let it sit for 1 minute, 2 minutes, up to 5 minutes. At that time, we were seeing, can we remove fat? Can we tighten the skin? From that generation, the next generation that came out, we had needles that were uninsulated. All of the needles were uninsulated, and just the plate around it had a polarity to it. So it was creating bulk heat. The problem that we found is we couldn't control how long that radiofrequency was staying on. So we were getting thermal burns. So anybody who wasn't a skin type 1, 2, or 3, we were concerned, can they get hyperpigmentation? The third generation that came out, they started putting insulated needles. And we said, okay, we can really control where the energy is going to be. Where it's very useful for is for acne scars at that time. When we're trying to use it as three-dimensional remodeling, we found it doesn't work as well. You have to put so much heat inside that oftentimes you'll get track marks. You get little patterns of where those needles are put inside the skin. That third generation is devices like Infini, Genius, Morpheus. All these devices we thought that we can do so much with. And then of course during that time was also Secret RF. We have these types of devices, and Vivace. The biggest differentiation is when the fourth generation came out. That's the Scarlet S RF. What that particular device does is something that none of the other devices do. It uses an uninsulated needle, which you would think is going backwards, but only the tip, the very, very bottom part of that needle is uninsulated. And each individual needle has the polarity to it. So when you're alternating that positive, negative, you're creating heat just at the tip of that needle. And the longer you keep it inside the skin, the more heat that you're going to generate in a bulk fashion. But because of the way that needle is designed, you're able to actually take the skin, you can lift it, and you can use this like a heat gun or a glue gun to actually reset where the skin sits. So not only were we seeing the effects on just plain acne, but we're seeing three-dimensional remodeling of the skin. You're seeing that the entire skin can be lifted, reset where it is, and now we're able to treat the brows, we're able to treat the upper eyelids, the lower eyelids, we're able to take these nasolabial folds, and instead of just injecting them with these chemicals, hyaluronic acid, we're able to harness the regenerative capacity of our own body to lift and build through that area. The corners of the mouth get pulled up. And the one area that we were never able to address properly, which is the neck, we're now able to reset where the neck sits. What we're finding is we're truly regenerative medicine inside the body. We're harnessing the power of the body. So that's the biggest difference in this entire category. So I agree, it's hard to find one tool that does everything. The Scarlet is unique because it can do the entire face. It can do the scalp so you can help regrow hair. You can do the neck to regenerate where that skin is, remove some of the wrinkles as well. The chest, the arms, the body, the legs, we can utilize it. Is it the best in market? It's best in market as long as you have patience. There's going to be other devices that we can use to pair with the Scarlet to get even more enhanced results. But for one device to do that much, it's unique.
So what do you think that is, there's a, I know that you are KOL doctors for a lot of companies, and everybody trusts on your expertise. So everybody takes the systems to you.
Yes.
What is the main difference between EndyMed to Scarlet? Because they say that it's almost the same. Can you
Definitely.
tell us?
So it's interesting. I've been very fortunate over my last 24 years. We've had the opportunity to work with so many different companies. Currently, I'm working with 36 different companies. Each one is presenting new technology, and we're seeing how we can better give results to our patients. When we talk about different technologies, let's say Scarlet versus EndyMed, they're very different. On the surface, when you put the terms in, you say, oh, they both have uninsulated needles. Okay, do they? That's fine. How is that individual needle working? What you see is with the EndyMed, that plate has a polarity to it, and each one of those individual needles has one or the other polarity, not both. So when you're utilizing something like that, if you have two needles here, you're going to generate some heat in between, or it also has insulated needles, you're going to just generate the heat in between. But with the Scarlet, when you're taking that single needle and you're putting the energy there, you're literally using like a heat gun. With the EndyMed system, you're just creating bulk heat. So there's a very big difference in terms of what it can do. The EndyMed system will not allow you to take the skin and reset it. Will it make the skin healthier? Definitely. Anything that we traumatize the skin, anything that we put enough heat inside the skin, you're going to have some collagen production because you're going to have activation of the fibroblasts. But when you say it's the same, it's not even close. You can't actually take that skin and refuse it higher on the SMAS, higher on the fibroceptal network with the EndyMed. You can only do that with the Scarlet.
So, Dr. Na always talks about the differentiation about the generator that they created in the US. What can you tell us about it?
The generator?
Yeah.
Okay.
So they developed the generator, the RF
Yes.
generator in the US.
Good.
Is it good for? It really makes a difference.
Yes. So in terms of how we can generate radio frequency, and we know radio frequency is just a polarity. It's positive, negative, and you're going to switch that polarity, and that's going to affect the water content inside the skin. So when you have that water molecule, each one of those water molecules has a positive and negative to it. So when the positive gets to the positive, it pushes that away. And the more efficient that you can generate that pushing away, you can turn that water molecule faster. When you turn that water molecule fast enough, you're going to generate heat. So you can have direct, very, very efficient heat production. So when you talk about an RF generator, radio frequency generator, they're not all created the same. The majority of systems have a 1 hertz system that's inside there. So with the Scarlet RF, it has a 2 hertz with an extremely efficient generation of radio frequency. So what does that mean? For shorter pulses that are inside there, you can really target certain aspects of the skin. So it's very, very different. So that's the one thing that you do want to compare across all of these different devices. What's going to produce the greatest energy, the cleanest energy, and the fastest energy, so you're not going to cause thermal burns with any of these devices.
La gente no sabe, pero tú hablas algo de español.
Sí, solamente puede hablar en español unas palabras. Puede jugar en el fútbol para mucho tiempo con español.
Ahorita estábamos en, you got me to one booth, and tú dijiste, el Scarlet es seguro.
Scarlet es más seguro de todo que están en este espacio de radiofrecuencia. Este es porque solamente puede poner energía para unos segundos. Si es menos de 300 segundos, es muy seguro para el piel. Después de ¿cómo se dice? More than, más de.
You can say it in English.
Yeah. When you have more than 300 milliseconds, you're going to affect the dermal-epidermal junction. Y cuando hace recibe uno quemo, que puede quemar el piel.
Okay. So, in terms of patient comfort,
There's a big difference in patient comfort between all of these devices.
okay.
And in the past, we used to say, you just put the topical numbing medicine. And when the patient suffered with Morpheus, with Endimed, with all these other devices, Vivace never hurt that much. You know why? Because 50%, it's actually 48.2% of the needles don't penetrate inside the skin. So if it's not penetrating inside the skin, there's no pain. You don't have to worry. But when there's needles that have proper motor strength and they penetrate inside the skin, you're going to have pain. And every other company up until Scarlet came out, even when Scarlet came with Dr. Na, they said, this one doesn't hurt. I said, okay, I've heard this before. And every company would blame whatever the numbing medicine that we used. Okay. Oh, you're not using plasticized lidocaine. You're not doing this. No, patients suffer. And so what we had to do is take extra time. We would be like the dentist. We put a nerve block here, 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 here. They still suffer. With the Scarlet, it's so simple. We just use pharmaceutical grade lidocaine. It's BLT, betacaine, lidocaine, tetracaine. It's whatever your pharmacist gives to you. I don't care what the cream is. You can be plasticized, non-plasticized. You put it on 30 minutes before the patient comes to your office. It's extremely tolerable. As a man, on the Y chromosome, what we realize is we don't have that much pain control. When you have the second X chromosome, you have good pain control, right? That's why women have babies, men don't. What we realized, even men, even myself, when I had the treatment, all I did was put the topical numbing medicine. Whereas I've tried Profound, Infini, Genius, Vivace, Secret, what other devices? Morpheus. They're brutal. You can't tolerate I can't tolerate the pain. And our patients, oftentimes we used to say you have to do 2, 3, or 4 different procedures in a row, 1 month apart. Oftentimes they'll pay for that procedure. They'll do one, they come back the second time because you fooled them the first time. The second time they come back and they never come back to your office. So it's very, very different in terms of the way that it works. But it's based on the motor and it's based on the efficiency of the radio frequency generation.
So thinking about the results and also thinking about the business, because it has to be a business.
100%.
Making it not that painful and seeing the results, the patient will come back.
So when you have results like this, not only does the patient come back, especially because it's comfortable or it's tolerable, but when their friends comment on how their nice skin there looks, they bring their friends. So we have one patient, she has referred 8 different people. 2 of them flew in from New York. 1 flew in from Tennessee, and 1 is coming from Washington State. So when you have those type of results with comfortable type things, everybody asks, they say, what are you doing? You're doing something different with your skin. And she says after 2 bottles of wine, it takes a little bit to loosen the tongue, then she tells what the truth is. Yeah.
So
why is it important to have 3 sessions?
Okay, good. So people often ask, how many sessions do we need to utilize to get the best results? It depends on the age of the person. If somebody's in their 20s or 30s, we're doing prejuvenation. Most time that skin is very, very healthy. So I'll do 1 session, and then at the 4 to 6 week mark, I do 1 more. That way it keeps the inflammatory response inside that skin for longer, so the fibroblasts stay active. You're producing collagen, elastin throughout that inflammatory response. When you have somebody in their 40s, 50s, 60s, it changes. Let's say somebody comes to me at their 60s and they've never done anything, and the only thing they've done is just live in the sun, enjoy their life. It takes a little bit more time and more sessions to reset. So oftentimes for patients like that, we're gonna do 2 sessions. The first session and then the second session, they're gonna be separated by about 3 to 4 weeks. Then we're gonna do a 3rd session about 6 to 8 weeks later, and then we're gonna wait. And we wait about that time 2 to 3 months. Again, we're keeping that cell active. We're gonna keep the fibroblast awake. So it really depends on the person. It's not always 3. It just depends on who that person is and how healthy their skin is. So we have some people that come to us, they're in their 70s, their skin, because we've been doing things over the last 20, 24 years, their skin is healthy. So we just do 2 Scarlets and then we wait, and we're gonna separate that. We wait 2 to 3 months to see, do they need a 3rd session? And then for maintenance, once that person looks so good, the skin is lifted, the texture looks good, they don't have a lot of fine lines, then we maintain it. And depending on the age of the person, sometimes it's once a year, sometimes twice a year. And occasionally it's 3 times a year, but it's rare for 4 times a year. So it's going to be very, very dependent on what's that person's skin health.
So it's safe. You did the first 3 treatments, and then next year you're gonna do 1 or maybe the second one. Is it safe?
Extremely safe. So the question that I get often is, how soon can I do my next treatment? Especially after that second treatment, they start seeing the skin changes. It glows. It looks like your 14-year-old or 17-year-old daughter. Everything is just dewy. It just reflects the light so nicely. They don't look red, they don't look tired. It's not just about fine lines, it's how is the light being reflected from the skin. And so oftentimes people will say, well, how many times can I do this? And we have one patient, she's 68. She insists on doing it once a quarter, but she has not had to have a facelift at 68. We've turned back the clock. And so it's extremely safe to do. The other question about safety that I get is this device gonna melt fat? Because of the way that Dr. Na designed this, where you can only have 300 millisecond pulses, it's next to impossible to destroy the fat. If you're looking to destroy the fat, let's say submental area, what can you do? You're gonna hold it there and you're gonna fire, 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 fire. So eventually you can get enough temperature that you're gonna get apoptosis of the fat. But that's around 71 to 72 degrees Celsius. So I would be cautious with that. Some of these other devices, especially Morpheus, when you're doing the burst mode, you're putting such a high level of energy. With one firing, it's going pop, pop, pop in 3 levels, but you're generating so much energy, we're finding that it's permanently denaturing the collagen and it's destroying fat. So you have to be cautious with a lot of these other devices. With this one, it's extremely safe.
When you told about the 3 pops, the 3
burst
shots, it's not like the same we do with just one with Scarlet.
Nope. So what happened with the Morpheus when we were designing that system, because I got to do some of the FDA trials for them, actually we created that burst mode. We couldn't control how long that pulse sits inside the skin. With the Scarlet, you have 3 different numbers. You have level 1, level 2, level 3. What that indicates is how long is the needle sitting inside the skin. So let's say if we want to do scalp regeneration, we want to actually grow hair, we're going to do a level 1. We know that it's going to sit in the skin approximately 100 to 150 milliseconds inside the skin. If we're doing a level 3 that we want to do something on the abdomen, we know it's going to sit inside the skin longer. So we can really control that. A lot of these devices, especially the Morpheus, they have not been able to figure out how to change that graphic design to change how long it sits inside the skin. So to get a more powerful effect with one trigger, that's why they're putting in 3 stacked pulses. That's not safe to do with most of these devices.
You told me last time that I saw you, you told me that you test a lot of systems, but you only keep and buy the ones that you think they are good.
Yeah. So right now, in the space of RF microneedling, there's 20 different devices that are FDA cleared in the US, 20. We have 8 of them. The majority of them are the graveyard because it was the next generation came out, it was better. And for our patients, what I guarantee is that we give the best technology in that space. Right now, we use Scarlet multiple times a day. Just yesterday, before I left my clinic in Houston, we had 4 patients that were being treated with Scarlet. So we know that it works every single time. And if a company asks me to test a device, they often say at the end of the testing, would you like to purchase this device? If it doesn't work, I don't purchase it. So I can tell you right now what we use the most often, we're using Scarlet. Do we combine it with other things? Of course. We're going to combine it with neuromodulators. We're going to combine it with fillers. We're going to combine it with skincare. We're going to combine it with regenerative medicine. So we're using things like Radiesse. We use Sculptra. We use exosomes. We can do PRP. So there's so many things that we can do where the Scarlet is going to enhance our results. And we didn't have this tool before, so we use it on a very frequent basis within our office.
Doctor, you used Radiesse after the 3rd session.
Good. So the question is, when do we use our regenerative medicine? So when do we utilize Radiesse? When do we utilize Sculptra? So a lot of times what I'll do is I'll do a single session with the Scarlet, and then I'll apply the Radiesse on that second session. And the reason for that is with that first session, about 3 weeks later, at that first session, we're activating the inflammatory response. We're bringing in the fibroblasts. We're making them awake. So then when we do Radiesse, we do Sculptra, when we do something that has a higher consumable cost, we can get more of a wow. Yeah.
One session? Or?
It depends on the person. So again, everybody's a little bit different, so we're gonna see what the goal is. If somebody has a lot of fine lines, we may actually utilize our Sculptra rather than our Radiesse, and we're gonna put the Scarlet about 3 weeks again. The second session will be 3 to 4 weeks after that session of the Radiesse or Sculptra. Yeah. If we're doing something like arms, tops of the knees, we'll do the Scarlet first. We wait 4 weeks. We apply the Radiesse or the Sculptra, and then we're gonna put the RF microneedling, the Scarlet right on top of that, and then we're gonna wait about 2 months now to see what change there is. Yeah, it works incredibly well, even for the buttocks.
Okay, and when you do like a 55-year-old woman or man, depends on the sagging of the skin.
The laxity.
The laxity. How many passes do you normally do?
Good.
1 or 2?
Good.
Or which areas do you do more?
Good.
Treat more?
So
More than one pass.
You got it. So the question that's being asked is, how do we customize our Scarlet treatments for the patient? And the best part is this: we use our smart fingers. So before we do the exam, we see where the laxity is. We make sure that they're not too low. And then we're gonna lift up with our non-dominant hand. We're gonna use our Scarlet to fire, and we're gonna reposition the skin. We do the other side. Then we come back and we check for laxity. And if you have more laxity, we're gonna do a second pass. If we need to do a third pass, again, after the second pass, we examine. Is there more laxity? Okay, I need one more. So we'll do a maximum of 3 passes with the Scarlet, but most times it's 1 to 2 passes, and it just depends on the skin health. Yeah. But it's all about the smart fingers, right? That's the beauty of clinical dermatology, plastic surgery, aesthetic medicine. We're gonna utilize our knowledge and our fingers to make sure that we can get customized results for our patients.
And around the eyes?
Around the eyes, depending on most people, if we're doing the lower eyelids, typically I'm gonna do 3 passes. And we're gonna do the first pass depending on the age of the person. Let's say it's somebody relatively young, 50 or below. The first pass is gonna be 1.2 millimeters. The second pass is gonna be 1.0 millimeters. Third pass is gonna be 0.8. If it's somebody who has a more mature skin under here, maybe they have a little bit of fat pad loss, then we're gonna go with the lower setting. We're gonna go 1.0, 0.8, 0.5. And again, we're utilizing our knowledge of anatomy to see what's the depth that we should be going to penetrate and give the proper heat. If we go too deep, let's say you set it at 1.5, we're just bouncing off of the orbital bone, so it's not doing anything. It's not effective at all.
And after
Blepharoplasty? Okay.
Surgery, after the surgery, how long, is it time
Good.
to do the Scarlet?
So a lot of times when we do surgery for the upper eyelids, we say that it lasts about 7 to 10 years. It can, or we can make it last a lifetime by using Scarlet. So typically approximately 1 year after the bleph, we're gonna go in and we're gonna continue to keep that cellular level active. So we're gonna reactivate those fibroblasts about a year later. And you can do that once a year, you can do it twice a year, and continue to have the same bleph results. And in fact, oftentimes we enhance it. The beauty of using the Scarlet, especially 1 year later, it actually fades the scar. So we see some people where you have a hypopigmented scar that's there, or a hyperpigmented scar. When we utilize the Scarlet, we can make the melanocyte grow back into that area, so you don't see that there's an actual scar there. Yeah, that's a good question.
So you told us that for scalp, for growing hair, how does Scarlet help?
Good. So the Scarlet is actually going to be used as a radiofrequency microchanneling device. And so we're going to be able to put our exosomes, our PRP in the right depth. We also realize that when you're using the Scarlet, you're causing neovascularization. So one of the things that we see as we have advanced age, we continue to have birthdays, we have less blood flow that's going to go to the hair. So anything that's going to increase the blood flow is going to improve the overall hair. So whether we do regular microneedling, whether we use Scarlet, we can utilize that to improve the blood flow. Second thing that we realize is when you have neocollagenesis inside that area, we're actually stimulating more of the hair bulb as well as the, it's called a melanocytic stem cell to grow. When you have the melanocytic stem cell, what we notice is we are going to find that the hair turns back from a silver color more towards the natural color of that person. So it's pretty remarkable what we can do. And you don't have to go to deep depths. You're typically around 0.8 millimeters, a level 1, and a power of 5 to 6. So we're not trying to destroy any hair follicle. We're just improving the overall, the soil where the hair is growing.
What about, is it safe to use it in active
Acne.
acne?
Good. That's a great question. One of the biggest things that we see consultations for, they're coming off the internet, we don't even advertise, is for acne and acne scars. Everybody's looking for a cure, and not everybody wants to utilize oral medications, whether it's an oral anti-inflammatory like the tetracyclines. They may not want to use high-dose vitamin A, or they've had a family member or themselves that have had negative impact from those oral medications. So the beauty of Scarlet is because, again, the way that the needle is made, you're able to go in there at the various steps of where the sebaceous gland is going to be held, and you're going to shrink that sebaceous gland. With the byproduct of heat that's being generated, you're actually going to destroy that propionine bacterium. So you're going to decrease the inflammation, you're going to decrease the oil production, and at the same time, because you're shutting down some of that vascularity as well as improving the health of the skin, you're going to notice that there's less transepidermal water loss. So the skin doesn't feel dry, it doesn't feel like it has to produce more oil. So that combination is extremely safe to use in active acne as well as acne scars. And for those who have active acne, typically anywhere from 3 to 5 treatment sessions, you realize it works quite similar to isotretinoin, where you're going to have long-term clearance of that acne.
Thank you so much.
Yeah, my pleasure.
What about the combination of isotretinoin
Yes.
with Scarlet?
Good. So the other question that we get asked by dermatologists, when can we add Scarlet while that person is on high-dose vitamin A? Because it's not laser resurfacing. Our change in the pathology and understanding how the skin is healing, we realize that you can do it during that treatment of isotretinoin. It's extremely safe. We're not resurfacing that skin. We realize if you're doing dermabrasion, you're doing fully ablative lasers, we're removing the top layer of skin. That's a very different thing. If you're removing less than 70% of that skin layer, which Scarlet is not even close to that, then we find that it's quite safe to utilize even during that treatment of isotretinoin. Yeah, that's a great question. It's
Thank
good.
you so much.
Thank you. Thank you. It's a pleasure.